Dr. Matthew Flesch is a physician for Trinity Health System in Steubenville, in Jefferson County. The coronavirus has certainly penetrated eastern and southeastern Ohio at a slower pace, initially at least, but now it is everywhere throughout the state. And so, Doctor, thank you very much for joining us and telling us a little bit about what you're seeing in the eastern part of the state.
Sure. Thank you, Governor, and thank you for reaching out to the people of Jefferson County. I think you have the theme here of different perspectives from different areas of the state. It's so variable. Being in a rural area, it's quite different than being at Grant Hospital, being in Cincinnati. We're not in the middle of nowhere. We actually are nearly a suburb of Pittsburgh, Pennsylvania. But we just haven't felt the ramifications of COVID yet. So if you go back to the numbers in our hospital, back in the original surge in April, our peak number of hospitalized patients was 9. So this went through the summertime, and we eliminated elective surgery. And at one point, there was a major reduction in the census of the hospital, such that I run a hospitalist group, a group of hospital physicians as well, and I sent advanced practitioners home, I sent doctors home. And then in the middle of the summer with the second peak, we only reached a max of 5 patients in the hospital. So again, we started to increase activity in the community. We opened schools. We didn't see a spike. But my theme now is that things are different, okay? So in the past 2 weeks, we have reached a point to where our max hospitalization in this hospital right now is 34. And I would expect that it's going to climb. So, we never felt the same type of impact that others did in the state. And so when restrictions have come, there's been a great deal of frustration here. And I think you feel that the fatigue of following the rules, following the mask, following the distancing. But I can tell you that as of now, things are different. So we are now feeling the impact. The type of patients that are coming to the hospital now are those patients that we worried about all along. We planned for them extensively in April. We went through hours and hours of meetings and logistical planning and everything you could think of to make sure that the patients were well taken care of. We had a disaster plan. We were accepting patients in the southeast part of the state. But what happened is we ended up just taking patients to help others out, and we didn't have patients in our own community. We were fortunate for that. And we had a number of elderly population that stayed pretty locked down in this community. But I would say as we approach Thanksgiving, the reality is that it has changed and we are stressed. We have always had a problem with nursing. And if you ask any hospital representative in this state, they're going to tell you that they've always had a problem with getting nurses. I mean, this is a national problem. So given that, the stress and strain of losing any staff right now is impactful, and we really are feeling that. So as we lose staff from the virus, and as activity picks up, and people, in Ohio, we move together in the cold and viruses accelerate. This is the nature of the business, and we're used to it in hospital systems. But COVID is different. It's a nasty virus. We've always known that from having treated it before. We just never treated it in this kind of volume before. So yes, now is the time we are feeling it differently.
And you touched on a little bit, but the situation with personnel, hospital personnel, nurses, others, how are you doing in regard to that? And what's the future look like, you think?
Yeah, it's a matter of a change day to day. It's planning every day. We have meetings constantly to reassess that. We met right before this meeting. So as of now, I would say we are stressed because our nurses in the critical care field are limited. We may have real estate for patients. In other words, we may have beds open, but finding staff is going to be the issue moving forward. And we're always going to be able to manage that in some way, shape, or form. We're going to serve the community. We've planned for this for many months. And now come the time where we're actually having to put these plans in place. But I would say as of now, we are very strained. We are trying to reorganize our units. We are trying to gather excess help from other areas that we may have not called from before. We're asking advanced practitioners here in the near future to help us out, maybe at the bedside, some ambulatory nurses to help us out in the acute care setting. So these are things we have thought through before, but in reality it has now hit us to the point where I have concerns about the time around Thanksgiving.
And this was late coming to Jefferson County, and really you're part of the state. Didn't get really that much in the spring, I guess, that much in the summer. But what's your message then to the people of Jefferson County as far as Thanksgiving and going forward?
Yeah. Well, I think people just need to be reasonable. People have been through this long enough to see things and have their own opinions about how they go about the mitigation. But the reality is, with our population here of older folks, now is the time to be reasonable with them at Thanksgiving and protect them. I had the same thing happening in my family for the first time. I've been an advocate of trying to be out and about as much as we could to keep the kids in school as much as we could. But I'm reeling it in myself and saying, for my parents this time, I say, we're going to Zoom at Thanksgiving for this year until we see how things come out in the coming weeks. Certainly we're all waiting for the vaccine, but at the same time, we have a great level of protection we have to give in the meantime. I think people can be reasonable. I think the mistakes are being made that are pretty straightforward. People are sick, they're coming in the house, they're getting your mom and dad. There's some things like that are easily solved. And I just think at Thanksgiving, we really have to just take a step back and say, you know what, Jefferson County, it hit us now. It's here. And it's different.
Dr. Flesch, thank you. Good luck to you and your team there. We thank them for everything that they do. We know it's a tough job always, and it's even tougher now. So thank you. Appreciate it very, very much. Our fourth guest today is Jasmine Shavers, nurse in Dayton, Miami Valley Hospital.